Welcome back to Close Up. If there's one thing we've learned in 2020, it's that no one really gets a break from a pandemic. And that's certainly true of hospitals, which have been weathering the worst of this particular storm since day one in New Hampshire. Here this morning to provide more perspective on how some of the state's biggest hospitals are handling this second surge are Alex Walker, Chief Operating Officer of Catholic Medical Center, and Dr. Greg Baxter, President of Elliott Health System. Thank you both for joining us this morning, gentlemen.
Yeah. Good morning, Adam. Good morning.
Dr. Baxter, let's start with you and the current surge issue. How much of a worry is capacity right now and in the weeks ahead as we see these numbers go from hundreds to potentially over 1,000 a day being diagnosed with COVID-19?
Well, first, I'd say it depends on which day you ask me. So on a Friday morning today, our new normal and our new stress level, this feels relatively good. We're at 34 COVID patients, 8 in the ICU, of which 5 of them are on ventilators, and a census in the hospital of 265. That's remarkably better than 48 hours ago when it was 285 patients and 46 COVID patients within that 285. It's changing day by day, but we're managing it, and we're getting a lot of cooperation from around the state to pool resources on inpatient capacity.
Mr. Walker, what's the status at CMC? Is capacity an issue if you had to move any patients anywhere?
So, as Greg said, we're facing similar circumstances here at CMC. And last night was a better night than the previous 2 nights. We had last night 28 COVID patients, and that's been pretty consistent over the last few days. Our numbers, since November 10th have doubled. Statewide numbers for hospitalizations are twice what they were back in May when we had our first surge here in New Hampshire. So we've gone from, a high water mark of 126 hospitalized COVID patients in the state to, I think last night there were 258. And CMC and Elliott here in Manchester have been, really at the epicenter of this crisis. And we've seen, I think, collectively, well over a third of the hospitalized COVID patients in the state. We have really done, in my estimation, a remarkable job of dealing with this crisis, from the very beginning. It's been an unrelenting year, and, we are right now in, surge level situation here in the city. Like Greg said, it's day by day, and we are prepared for what's next, but I think the next several weeks will be challenging for everybody.
And certainly the hospitalizations lag the cases, and then the deaths lag the hospitalizations. Has there been any improvement in the treatment of the disease? Everybody knows a little bit more now than they did in March and April. Dr. Baxter, are outcomes a little bit better now? We hear the governor sometimes talking about, the hospitalization rate is not as high. Are you seeing the same kind of thing there, I guess?
Yeah, so it's a bit of, it's not fully known yet. What we're seeing as far as outcomes, but it appears to be that perhaps the patients are doing better from a combination of reasons. Most commonly, our treatment modalities have gotten better. We're fine-tuning things we learned in the spring, and it's really been a worldwide learning and a lot of sharing worldwide in the medical community. So earlier steroid use, what's known as dexamethasone, remdesivir, treatment modalities of how we supply oxygen, and really understanding how to fine-tune those things has helped. It also looks like that this particular 2.0 of the surge appears to be, while still requiring ICU level of care, the majority of patients are actually on our medical surgical units, which is good in the sense we have more capacity there than the very scarce resource of ICUs. But it's still a little bit early to tell. And as you said, things are evolving day by day. And right now we are in a place that statewide we have the capacity we need. But I would point out we're in that magic 2+ weeks out from Thanksgiving, which we all talked about was when we had expected to see the effects of the holiday gatherings, right? And more social connections among people. So that's kind of what we're seeing right now, we think. I'd love to, with Alex, know that the high water mark was 2 days ago, which is when we were really high census. we'll see what the weekend brings.
And Alex, we know the beds are there at the moment, and they can add capacity with some of those surge facilities, the state and the National Guard. What about personnel? You can't just manufacture new doctors and nurses.
No, you can't. And you know, on the long list of things that keep all of us awake at night, just the staffing challenges, you know, are at the top of that list. And, you know, we've gone from, you know, having, you know, 10 or 15 employees on quarantine back in May to over 90 now. And those are folks that are COVID positive, folks that have a travel restriction, folks that have had an exposure and need to stay away. And those numbers are really putting a lot of stress on the rest of the organization. But, you know, our first priority obviously is keeping our employees and our patients as safe as possible. But the workforce challenges, you know, here at CMC and no question around the state have been a significant challenge for everybody.
You mentioned stress. Dr. Baxter, what about provider burnout? I know everybody's just working around the clock. This is the whole building. It's a team effort. But are you worried at all as this goes on? And that light is at the end of the tunnel, but the amount of, you know, the toll this is taking, I guess.
Yeah, you raised a great point, and I think, much like Alex said, we're blessed in healthcare in general to have people who chose this as their profession and their mission. But we are really testing people's resilience, and you know, Alex and I and our teams work very hard to try to find the right ways to position our staff for success. I think that the vaccine on the horizon is definitely a bright spot. It feels like one of the game changers in this pandemic that it might, and we are hopeful that it will provide a level of safety for our staff and maybe remove one worry for them. But the daily grind of wearing personal protective equipment can't be understated. So as far as stress level, I think it's definitely there. I think there is a silver lining in this, in that if you were ever wondering in the healthcare profession whether you were mission driven and having an impact on your community, well, this is example A. We are needed more than ever, and I think we're stepping up to that. But I think we rely on each other too to keep spirits up, and that shared burden again is really important as far as a mindset.
That vaccine arriving within days. Alex, describe for us, this is going first to, you know, people who need it the most, which are the providers, because they have to do the work. When are you going to be able to get your doctors, nurses, and staff vaccinated there at CMC?
Well, I mean, we're just waiting on the arrival of the vaccine. And so as soon as it arrives, we're going to get people vaccinated. And we've been working very closely over the last several weeks internally with our own vaccine task force, connecting with the state as they prepare for the arrival of the vaccine, identifying those employees and other folks that are kind of on the front lines, that are in the most at-risk category, and so those folks will be first in line to get the vaccine. But we're prepared for it today. Hopefully it will arrive sometime next week, and we can start the process of getting people vaccinated.
An interesting quirk, as we were talking before we started recording here, you two gentlemen were the last civilians essentially to appear on the set with me in an interview back in March. I want to ask you a question here. If we could rewind the clock 273 days and you could somehow communicate to yourself back in March, what would you say about you know, what to prepare for? Let's start with you, Dr. Baxter.
I think back to March, it's almost a little bit hazy in my memory. I recall back then really the unknown parts of COVID. I think reassuringly, we took it very seriously, did the right things to give ourselves the capacity that we anticipated needing. That was with the shutdowns of basically everything that wasn't urgent or emergent. I never anticipated the PPE shortage. And the fact that, like other people around the country, we had some Yankee ingenuity here in Manchester. We were building our own isolation gowns and those types of things. I think if there was something that I wish we had been more cognizant of, was really sort of understanding the lessons learned in the spring and really working even harder than we did collectively as a society, to make sure that we were aware of the impact we had with some of these measures, adjusting them appropriately, and then perhaps really doing better to battle COVID fatigue, which I think we all kind of went through in summer and early fall to find ourselves where we are now. So it's a progression of responses, and I think we had the muscle memory from the spring, but I would have told myself back then that Thanksgiving would be an inflection point for us.
Yeah. Quickly for you, Alex, what would that message be that you send back to yourself 9 months ago?
Well, I think to myself and to the rest of the team here at CMC, I think we went into this, preparing for the worst and hoping for the best. We have learned a lot of lessons. This has been, as I said, an unrelenting year, and I feel like, we've all aged in dog years, over the last 9 months. I must say, the lots of lessons learned, but, just leading from the front, leading by example. Our team has done that each and every day, and having both of these hospitals be at the front lines of this crisis. We have more experience dealing with COVID patients, just given the fact that we've seen the numbers that we have seen. But it's been a long, hard year. Like Greg said, we're seeing some light at the end of the tunnel with this vaccine, and we'll continue to do what we do every day here at CMC, which is care for these patients with skill and with compassion, and with an optimistic approach.
All right, Mr. Walker, Dr. Baxter, thank you for your time, and good luck out there on the front lines. We appreciate it.
Thanks very much.
Thank you.